It's a growing public health issue more common than pediatric cancer, diabetes, and AIDS combined. A few decades ago, it affected 1 in 10,000 live births. Today, its numbers and diagnoses are growing at an alarming rate. Autism. It is a diagnosis no parent wants to hear.
There's been a sharp increase in the trend in the numbers of children affected by autism. It's at a point now where we're looking at 1 in 150 births. We think this is due to many factors, actually, but it is certainly due in part to greater awareness by parents, pediatricians, and teachers, as well as the public at large, of the signs and symptoms of autism.
And while it can be a hard diagnosis to accept, parents are usually the first to notice unusual behaviors in their child.
He didn't make eye contact and actively avoided it. You'd have to hold his face to see his eyes and make him look into yours. He didn't speak in a meaningful manner. He didn't respond to his name.
He became more withdrawn. He lost the language he had. And where we really noticed it was trying to take him to new places. He simply couldn't tolerate any change in routine.
Searching out the best treatment for a child with autism is usually a parent's first choice. But with the array of treatments and treatment modalities, it can be hard for parents to decide what is best for their child. And the decision can be overwhelming.
I just remember going to the doctor with him, and they gave me the diagnosis and handed me a packet and said, good luck, fight hard for him, get him as many educational opportunities as you can. There's no cure.
We did try some medications, and it was very loopy, and we just didn't like it. It wasn't a quality of life we were looking for our son.
There are many schools of thought about what works and what doesn't work with individuals with autism. Many professionals often offer treatments that are not yet validated, and historically, many of these procedures have proven to be ineffective.
What's really encouraging as a clinician is that with everything that's out there, the Surgeon General, the National Research Council, and other researchers in the field continue to validate applied behavioral methods as the treatment of choice year after year.
Based on this research, perhaps the most effective form of therapy is the ABA model, Applied Behavior Analysis. Behavior analysis is a scientific approach to understanding all behavior, not just maladaptive behavior.
ABA searches for the controlling conditions which set the occasion for behaviors to be exhibited by using traditional scientific methods. It focuses on analyzing how we all learn from our experiences and interactions with the world around us, and provides us with a better understanding of how children with autism develop and respond to their environment.
For young children with autism spectrum disorders, most experts agree that early intensive services provide the best opportunity for positive outcomes. Effective ABA programs should be administered by skilled educators and therapists who are able to support families in carrying out strategies, even outside scheduled treatment hours.
It was only after probably a couple of years of her being in the school system that we started having more questions and saying, you know, we're not seeing the progress that we would expect to see.
It was really disturbing because you didn't feel like you're working as a team with most organizations. You felt as though it was an adversarial relationship.
What a lot of parents have told me is that they first come to terms with the diagnosis when their child hits school. What happens then is that there's very little learning that takes place and a lot of increase in disruptive behaviors as the child attempts to cope with an environment not designed to meet his needs. Very often for these children, what's required is a school with credentialed staff.
When it comes to treating autism, intensive early intervention and programs focusing on developing communication, social, and cognitive skills with significant hours per week are crucial. And while there is no cure for autism, effective validated treatments can make an enormous difference in the lives of many of these children.
I see a continued need for a cost-effective, clinically validated delivery model to meet the long-term living needs of individuals with autism. That also includes adequate public and private funding levels.
Both Pennsylvania and Massachusetts legislators have addressed the need for autism programs by introducing critical, groundbreaking legislation with the hopes that other states will recognize the importance as well.
Schools and programs need to focus on the effective, innovative, evidence-based systems of support that are designed to provide the highest results. And it's important for us to share the good work that we accomplish with the students we serve so the public as a whole is able to learn from it.
Autism disorders are difficult to understand for families and professionals alike. The key is finding a program that addresses this complex disorder while using the most effective tools to treat it. For many families, Melmark is that program. Through a unique partnership with families, Melmark's dedicated and highly trained staff takes a very personalized approach while defining and implementing effective goals and programs for each child or adult served.
From a small beginning in 1966, Melmark has grown to a point where we now have 800 staff serving more than 350 children and adults with developmental disabilities. We have developed classrooms and living areas designed specifically to meet their needs in both Pennsylvania and in Massachusetts. As the number of children diagnosed with autism spectrum disorders has increased, Melmark has turned its attention to serving this population. We have also developed behavioral consultation services to help children remain, if possible, in their community schools.
The educational, clinical, recreational, and athletic services offered at Melmark are designed to promote the highest level of functioning in each individual, with a goal of closing the gap with their typically developing peers.
We're proud to offer day and residential special education services to children and adolescents ages 3 to 22 with learning difficulties and/or challenging behaviors 24 hours per day, 7 days a week, providing the best opportunity to improve long-term outcomes.
At Melmark, the heart of our interdisciplinary model is treatment that's framed in applied behavior analysis, but it also integrates the expertise of other disciplines to ensure a scientifically validated treatment process. A key component of ABA is to address socially important problems, and that's to bring about meaningful change to an individual's life. This all results in skills that allows individuals to participate in the many joys of normal life.
Melmark's clinical model is based on the philosophy that each individual has specific needs that require education and clinical treatment to be tailored specifically to them. This treatment is delivered in a large context of sophisticated clinical systems that are designed to improve the child's life.
They've both improved in their communicative skills, and they've both improved substantially in their self-care skills.
Like we have the best of both worlds, really. You know, like he's safe, he's happy, and you know, we can do a lot more.
And now his behaviors have come down. He's a nice, very calm child, and it's amazing. It's like, you know, my child, I have my son back.
When people talk about Melmark, they talk about how we provide educational excellence for every child, every day. But what they love about Melmark is that we love their children. Our mission is to be excellent educators and clinicians, but also nurture these children into young adults and adulthood.
Brian's been at the school almost 3 years now. And what we love about this program is they don't only help Brian, they help our family be successful.
Caleb's really happy to come to school in the morning, and I think that the reason that he does want to come is because the staff that works with him really understands him and pushes him and is trained in the methods that work best for communicating with him and for developing his skills and abilities.
We see a lot of progress in Alana in looking at her now and how independent she is and how much she wants to learn and how much she wants to go to school, and that's so encouraging.
Melmark's treatments and educational approaches may reduce some of the challenges and anxieties facing families, all while creating lasting relationships with families in the care of their children. In addition, Melmark has also developed vocational programs for young adults that will assist them in preparing for appropriate jobs in the community.
The vocational program here at Melmark really focuses on getting our students and adults paid employment out in the community, and we do that by partnering with several businesses and organizations in the community.
The Melmark staff can assist families and young adults in identifying appropriate job opportunities, enabling them to gain self-confidence and greater independence.
Melmark's programs and services focus on supporting children and adults as they become active, contributing members of their families and communities.
Melmark recognizes the challenges a family faces in dealing with autism and other developmental disabilities, and is committed to providing excellence in services every day for each individual so they can grow, learn, and flourish. Melmark, expanding life's options for children and adults with special needs.